Hi everyone, welcome back to my YouTube channel and today we are going to talk about joints of skull. So let's start our topic with introduction. Joints of skull, also called the cranial joints, are connection between bones of the head. These joints are primarily immovable fibrous joints that are called sutures, which provide protection for the brain by forming a rigid protective case. A few joints, however, are synovial and allow movement, such as temporomandibular joint. Understanding these joints is essential in anatomy, especially for studying skull development, growth, and trauma. Classification of skull joints. First, the class is fibrous joints that are also called as sutures. Second is cartilaginous joints that are also called as synchondroses. And third are synovial joints. Fibrous joints of skull that are also called as sutures. They are sutures that are immovable fibrous joints that are formed by thin layer of dense connective tissue. It is present between most flat bones of the skull. It allows slight movement in infants, enabling skull growth. It ossifies with age, making the skull rigid and stable. Types of sutures include serrate sutures, squamous sutures, plain sutures, and limbus sutures. Serrate sutures are interlocking and has saw-tooth shaped edges, for example, sagittal suture. Squamous sutures are overlapping bevel edges, and for example, squamous suture between temporal and parietal bone. Plain sutures have flat edges that meet each other, for example, internasal suture, and limbus sutures are uneven edges interlocked in each other, for example, lambdoid suture. Second type of skull joints is cartilaginous joints that are also called as synchondroses. They are present at the base of skull where bones are joined by hyaline cartilage. These joints are immovable and ossify with age. Example of it includes spheno-occipital synchondrosis, that is between sphenoid and occipital bone in children, petro-occipital synchondrosis. Now let's talk about synovial joints of skull bones. The only freely movable joint is skull in the temporomandibular joint. Other synovial joints in head include those between ossicles of middle ear. Important skull joints include cranial sutures, temporomandibular joints, joints of ear ossicles, and cranial base synchondrosis. First is cranial sutures. Their key sutures of skull include coronal suture that is present between frontal bone and parietal bone, sagittal suture that is present between two parietal bones, lambdoid suture that is present between parietal bone and occipital bone, squamous suture that is present between parietal bone and temporal bone, and metopic suture that is present between frontal bone in infant and usually it fuses by age 6. Next important joint skull is temporomandibular joint, that is synovial modified hind joint between condyle of the mandible and mandibular fossa of temporal bone. It permits movement of mandible for chewing, speaking, and other oral function. Next important joints of skull are joints of ear ossicles. They are tiny synovial joints that connect the auditory ossicles. They include incudo-malleolar joint that is present between malleus and incus. Second joint is encudo-stapedial joint that is present between incus and stapes. These joints allow efficient transmission of sound vibration in the middle ear. Next important skull joint are the cranial base synchondroses. They are found in the growing skull of children. For example, spheno-occipital synchondrosis, spheno-ethmoidal synchondrosis, petro-occipital synchondrosis. These joints ossify as growth completes. Functions of skull bone joints. First is they provide protection for brain by forming a rigid cranium. Second function is they allow skull growth during infancy and childhood. Third function is skull joints facilitate movements of mandible for chewing and speech. Fourth function is they allow fine movements of ossicles for hearing. Fifth function is they provide sites of attachment for muscles and ligaments. Clinical significance of skull joints. First is craniosynostosis, that is premature fusion of suture that lead to abnormal skull shape. Second is Montanelli assessment, that is indicate hydration status and intracranial pressure in infants. Third significance is fractures, as sutures can act as a lines of weakness in skull fractures. Fourth significance is TMJ disorders, as these sutures can cause jaw pain, clicking or restrictive movements at temporomandibular joint area. Fifth significance is base synchondrosis, as these joints are important in understanding growth and development of the skull. Now let's talk about conclusion of this lecture video. Joint of skull include immovable joints, sutures, cartilaginous synchondroses, and few synovial joints. All serve to protect the brain, facilitate growth, and allow essential movements like mastication and hearing. Proper knowledge of these joints is critical for understanding head anatomy, growth, trauma, and surgical approaches. And this was all about joints of skull. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.